erase what I have here on the board? So we have the joints between the superior and inferior articulating surfaces. Those are synovial joints, but we also have joints between the bodies, and that's what we're going to focus on here. So remember the three types of tissues that hold bones together when we talk about joints as a structure? We talked about what was the type of tissue that held the skull bones together in the suture? Fibrous. Okay? And this tissue here is fibrocartilage, so that is a cartilaginous joint if we talk about it by structure. So the intervertebral joints between the bodies body to body are cartilaginous. Now, cartilaginous and fibrous joints are never freely movable, right? Those are only synovial joints, like the temporomandibular. So we have either freely movable or immovable. We have amphiarthrotic or synarthrotic as our choice. The tooth in its socket was an example of a fibrous synarthrotic, just like the suture. So is this a cartilaginous synarthrotic or amphiarthrotic? Amphi. Like if I twist my back like this, those two vertebral bodies are sliding on that piece of fibrocartilage. All right, so by structure, it's cartilaginous. By movement, it's slightly movable. Or amphiarthrotic. And there are 4 ligaments that I want you to be able to identify. We don't have them on a model, so it'll have to be a diagram. But if we draw, if I draw, royal we here. So vertebra to vertebra, if we have a very broad ligament running down the anterior surface of the body. So it would be found here or here. And that is known as the anterior longitudinal ligament. Okay, that would be this one right here. Then on the posterior surface of the body, within the vertebral canal, we would have a much more narrow band running the length. No big surprise, this is known as the posterior longitudinal ligament. All right. So if you were to hyperextend your back, would you be more likely to tear the anterior or the posterior? Hyperextend? Anterior, because that's the one that's getting stretched. Okay? And it's a little more difficult to hyperflex, so that we're a little more resilient with that. The other 2 ligaments are found between the lamina. So lamina to lamina. It's a little harder to see, but here's the pedicle, here's the lamina. So lamina to lamina is ligamentum flavum, or flavum. I'll just write that one up here. This is an aside, you don't have to write it down. But these are dense regular, well this part you need to know, they're dense regular connective tissue, they're ligaments. But in the neck, the ligamentum flavum is very broad and is elastic. So most of our ligaments are dense regular connective tissue. And in the neck, this one is elastic. I have an image of it here. Okay, there's posterior longitudinal. Ligamentum flavum, here, in the neck. Those are elastic fibers that provide greater mobility of the neck region. All right, and then the last one that you need to know runs along spinous process to spinous process, not between them, but just the spinous, the surface. So if you were to run your finger down someone's back, right, just under the skin would be the supraspinous ligament. So these are the 4 that I want you to know. When I was teaching the upper division course for physical therapy students about 10 years ago at Sac State, one of my students was on the women's rowing team. And it was just a couple months before trials for the Olympics, and she developed severe back pain and went to see her physician, who told her she needed to do more exercise. And she's like, I'm in my soccer uniform. This hurts when I exercise. I think I'm doing enough. And so she eventually got an MRI, and she had shredded her supraspinous ligament. It was just strands of collagen fibers holding that together. And she had to drop out of the rowing team because I think we talked about this a little bit. Collagen fibers, it's dense regular. It's not going to repair itself very well. I don't know if she ever got a graft to it or because the treatment came after our class was over that summer. All right, now between the vertebral vertebra, we have discs, and that's what creates our cartilaginous joint. And the disc is fibrocartilage out here and a gel-like material in the center that gives us more compression. So it's like having a really tough rubber balloon between each of your vertebrae, so when you walk, it helps to absorb that compression. Okay? However, that disc can do one of 2 things or both. It can slip or it can prolapse and actually rupture. And it typically slips backwards, at least that's when we get the pain, because here's the intervertebral notch. And guess what passes through that when it's formed as a foramen? Our spinal nerves. And if that pushes against that spinal nerve, you're going to get anything from a range of very sharp stabbing pain. If it's in the lower back, it goes down the back of your leg. Probably some anesthesia in the sense that you lose feeling.
Would that be the same thing as a herniated?
Yes. Okay, so here's another image of that. All right, let's finish with the curvatures, and then we'll take a break and come back for a short bit with the rib cage, and then the rest of it will be lab time. So here's a typical normal curvature of the spinal column. All right. Primary curvatures refer to the fetal curvature that a developing infant. So if someone says, you know, he was curled up in the corner in a fetal position, are we talking like that? Or are we all talking like that? So that's the way a baby is curled up, fetus, or in the uterus. So your primary curvatures are that direction, all right, that maintain that fetal curvature. So which of these would be primary curvatures? Cervical, thoracic, lumbar, or sacral? Thoracic. And then the other one would be the sacral, okay? So if we're starting out with curvature like this being anterior and posterior, and then we develop a curvature that looks like this, the 2 that maintain that orientation are thoracic and sacral. Those would be primary curvatures. Which do you think occurs first? The formation of the cervical or the formation of the lumbar? Cervical. When the baby starts to lift its head up, that creates the cervical curvature. So around 2 to 4 months. And the lumbar curvature is created when the infant starts to walk. Okay? So those 2 are secondary curvatures. If we get an exaggeration of the curvature, we have 3 different conditions. And I move this around so people could see the scoliosis one a little bit larger. Kyphosis, also known as, or more commonly now, used to be kyphosis, now they switched to hyperkyphosis, refers to an exaggeration of the thoracic curvature, right? So if I draw that in green, we have a normal cervical and an exaggerated thoracic. Hyperkyphosis, or in layman's term, hunchback. I had a cadaver for my students when I was teaching at Napa Valley College 20 years ago, in which the hyperkyphosis was given as one of 2 causes of death. So the death certificate read pneumonia secondary to hyperkyphosis. She was a slight woman in her late 70s, and her thoracic cavity, which normally would have been, let me use this bigger piece of paper, normally would have had a thoracic curvature like this. Then, like that, was like this. And so the coroner obviously felt that if she had had it more open, her lungs would have been able to expand, and she would have been able to properly oxygenate her blood, and all the fluid of the pneumonia would not have interfered with that process of gas exchange with her lungs. But it was so compressed and tight, they had no room to expand during normal pulmonary ventilation. So it was an interesting, I just never seen that as a cause of death. All right, if we exaggerate the lumbar curvature, then we have lordosis, or sway back. And I still remember as a child riding in the car somewhere with my family, this woman walking along the side of the street, and she was bent like this and then at right angles, and you could have actually put a dinner plate on her lumbar curvature and it wouldn't have slid off. She had to have a cane to walk with. This occurs, is not uncommon during pregnancy, as hormones soften the ligaments and the center of gravity shifts out to balance that. It's part of the waddling effect. Not everybody that's pregnant waddles. All right, just depends on the degree of this, but then it recovers afterwards. All right, so these are 2 different curvatures from a lateral view. Yes?
So people who are like short trunk versus long trunk, is it there? I mean, we all have the same amount of vertebrae. So is there vertebrae? Is the spacing different, or is the?
It's the body. So it's a neck to exaggerate your illustration. A giraffe has a very long neck. It's still 7 cervical vertebrae. As a mammal, that's typically what we have. So it's usually the body, not so much the. And as you get older, my mom used to be 5'9", I'm 5'10", 5'10 and a half. My mom used to be 5'9", now she's 5'7". So it's not so. There can be some compression of the bodies, but it's also, as you age, it's the discs that tend to compress more. All right, so this is a lateral view. From an anterior-posterior view, the spinal column should be straight. All right. Any deviation is called scoliosis. So that's the larger double picture in the middle. And I told you about my son being born with the lateral cleft lip and the x-rays that were done, and the nurse letting me read them. He had, at his 2nd cervical vertebra, instead of having a vertebral body that looked like this, he had a wedge shape. So you can see how that could contribute to a tilting or scoliosis of the vertebral column. Being at T2, it's not as likely to have a significant effect as if it was lower down in the lumbar region. And so we keep checking it when he has his physicals for sports or for high school. And so far he's okay with it. Doesn't have any scoliosis yet. All right, let's stop there and take a break.